Now, the gallons, like I can see, but we're not going to do that tonight. So the iliac crest is the top of his pelvis. Okay. The other landmark is the ASIS. Right there. Okay, the ASIS stands for the anterior superior iliac spine. It's like on the Olympians, if you guys are watching any of the track and field events, and they have like the low-cut shirts that they're wearing, it's where the V is. Okay, that's the ASIS. Okay, and the other landmark that we'll end up needing to know is the PSIS. Right here. And again, this is in our Olympic divers. On the back is the dimple. Or like your guys' generation like to get transdermal piercings. And when the ladies get their transdermal piercings, it's usually right in the PSIS, the posterior superior iliac spine. Okay? Is that helpful? Okay? So you got to feel for those. This is going to be like a little divot here, and this is going to be a bony prominence up here. Right there. Okay? You got to feel it. Nate, am I pushing pretty hard? Yeah, there's no way around it. All right, so these are both gluteal sites. Okay? So first we'll do the dorsal gluteal. Okay? To do the dorsal gluteal, most old school nurses will do this. They take Nate's butt cheek, his glute, right? And they'll draw crosshairs on it. And they'll just go in the upper outer quadrant. Risk of hitting the sciatic nerve if you do this. Okay? Not going to paralyze your patient, just going to like make their leg go numb for a few days. Okay? Not fun. So you're going to see a lot of old season nurses just pick the upper outer quadrant. Okay? I'll show you how we get there the proper way, okay? So we find the greater trochanter, okay? We find the iliac crest. We find the PSIS. And I've kind of got half of a box here. You see that? Line, line. You guys see the two legs of the box? I take a triangle, take a hypotenuse between the two. In reality, I'm just taking a line between the PSIS and the greater trochanter, okay? But this helps me identify the landmarks. So I make an isosceles triangle is what I'm doing. And then you see before, when I did it on Nate, I was going to give the injection here, and now I'm going to give the injection here. It's only an inch different, but it clears me from the sciatic nerve, okay? That's called the dorsal gluteal. The dorsal gluteal site. It's on the handout, yes?
Where did you pick the spot after you found your hypotenuse of your triangle?
I go right in the middle of the hypotenuse. Right in the middle of the hypotenuse. Guys, you always want to do the old, make sure you're going to hit muscle, not bone. Relax, why not? Okay. Now we're going to go to the preferred IM site. It's a preferred IM site because it's away from any arteries or veins or nerves, which the other ones all have a risk of hitting. However, it's the most difficult one to find. Of course. Right? So for this one, Jen, you're going to come to the other side to get this. For this one, I'm going to take my palm, I'm going to put it right on this greater trochanter. All right, center right on my palm. You guys good with that? I'm going to take my pointer, I'm going to take my middle finger, I'm going to point towards the iliac crest. Okay, I'm sorry, there's not a good spot for him to be in. My pointer finger is going towards the iliac crest. My middle finger is going towards the iliac crest. My pointer finger is going towards the ASIS. Okay? And then I know I'm using the correct hand because my thumb ends up pointing towards the umbilicus. Because I could do all that, but use the wrong hand. Right? So I got to use the correct hand. So my thumb is, I know I'm using the correct hand. It's Nate's left side. I'm using my right hand. My thumb's towards his umbilicus. My middle finger is towards his iliac crest. Right? My pointer finger is towards his ASIS. Right? And that's what the textbook tells you. Nate, take a feel. What do you think, bud? Want me to inject it with an 1-inch needle there?
Yeah, no.
No. Okay. That's the textbook answer. You guys good with that? Iliac crest, greater trochanter, ASIS. I do this modification. This is Tim Myers taking and saying that never seems like a good spot to me. It's always bony on my patients, right? So I just rotate my fingers. I take my pointer finger and I go towards the iliac crest. I take my middle finger and I go towards the PSIS. Nate, feel that?
Yeah, better.
It's not much different, right? I mean, like the difference is literally one finger breadth. Do you guys see what I'm doing? So on your textbook answer, greater trochanter, ASIS, anterior superior iliac spine, and iliac crest. What I would recommend you do in clinical is the old, is there bone there test? Okay, let me go ahead and do what Tim said. Let me move my pointer finger towards the iliac crest, my middle finger towards the PSIS. Okay? Make sense to you guys? Okay. So you guys go find them on your peers. Got next door and here. No one has to touch anyone if they don't want to.